I can talk about the side effects of Symbicort, but instead I'll talk about the side effects of the two constituents, or the two components in there, the inhaled steroid and the long-acting bronchodilator, Formoterol. Formoterol will have the same side effects as Albuterol. So if your child gets jittery or shaky with Albuterol, your preschooler runs around for the next 30 minutes, they can get the same side effect with Symbicort. And that's due to the bronchodilator component. Both of those are relatively harmless, really, and there's no long-term consequences to it. It doesn't make your lungs dependent on that medication, in case you're still got that in that mindset. That's just not the case. The other component, the inhaled corticosteroid component, it's not unique to Symbicort, first of all. Second of all inhaled steroids have the possibility for adverse effects, such as the ones I'm going to describe. It's not just Symbicort, whether it's Dulera, Asmanex, Flovent, Advair, Symbicort, or Pulmicort. To a greater or lesser extent, they all have the potential for temporary slowing of height growth. Now, this has been studied in childhood and followed up into adulthood. And virtually all children, and it's not dose dependent, meaning if you get a little small dose or if you get a whopping dose, the transient suppression of height growth is very common, and it's transient, and it's all steroids share this characteristic. In terms of what's the final impact, what the studies show is that it probably affects your final achieved adult height by a little more than a centimeter. So what's that? A little more than 3/8 of an inch. So if your child was destined to be 6 feet and they needed to have Symbicort early in life, they might be 5 feet 11 and a quarter or 11 and a half. That's all. That's the virtually universal side effect. Second, I'm going to list these in terms of likelihood. Second, if you don't use a spacer with a puffer, this is less of a problem with the dry powder inhalers, but if you do not use a spacer with a puffer, you're more likely to get a yeast infection in your mouth and throat. It's a nuisance. It's not harmful, but it's just kind of a nuisance. And you're less likely to obtain therapeutic benefit from the puffer because it's all being deposited in your mouth and throat and not getting into the lungs. That's where the spacer really makes a difference with puffers. Then we're talking less common side effects, but that are dose dependent. And that's why, going back to why I do all the testing in these preschoolers who have symptoms that are attributed to asthma, is if you fall into the trap, like I say, of continual dosage escalation, you're going to encounter this side effect. And the side effects of higher dose of inhaled corticosteroids include more lasting suppression of height growth, problems with bone mineralization, problems with excessive hair growth, problems with adrenal suppression, and problems with high blood sugar. So if you're diabetic, it can make your diabetes more difficult to control. Now, I could talk a lot on this, but I will say I'm going to limit it to the following. Kids are quite variable in how much of an inhaled steroid dose it takes to cause adrenal suppression. And I will investigate it if I see some suspicious signs. But the reality is, if you sent all the children on inhaled corticosteroids to an pediatric endocrinologist to test their adrenal function, you would be a little bit worried by how common it is. I don't have a handle on it, but I do know from experience that in dosages tolerated by most children without any adverse effect, I have seen the occasional child who in fact experienced adrenal suppression. So when I put a child on inhaled corticosteroid, I try and use the minimum effective dose. That's why I have a low threshold for switching to a combination product like Symbicort, that I already talked about, or Advair. And I do monitor for side effects. And what I'm particularly interested in is their height. And I want to see their height continue on its previous trajectory, or in fact start to cross percentiles, so they're growing more rapidly than they had been in the past. That's a good sign. It's when they start growing less rapidly, and to really detect that, you have to look at height velocity, which I do at least twice a year, because you can't get a good handle on it with any less than 6-month intervals. But if a child has shown evidence of reduced height velocity, that's the child I'll send to the pediatric endocrinologist, just to be safe, to check. And if they come back that they're adrenal suppressed, then we got to figure out how we can control their asthma but at a lower dose of inhaled corticosteroid.